is Sarah Squires bringing you behind the headlines in today's edition of WyoToday Newsroom. Today I am joined in the studio by SageWest, Jennifer Burrell, and Kenny Young. Welcome to the show, guys.
Hey, thanks for having us.
Likewise.
Yeah.
Great to see you, Jennifer.
So we are in the thick of October here, and I know there's a lot happening. It's Breast Cancer Awareness Month, but before we get to some of the things that you've got going on at SageWest to celebrate that, I wanted to talk about something that Jennifer and I were kind of going over, a little idea that is hopefully going to inspire young people and folks kind of, embarking maybe in a new career direction, and that is, what is your why in healthcare? What kind of got you into healthcare and guided your path to where you are today? And Jennifer, tell us a little bit about that question and what that means for you.
Yes, I love that you are posing this question. So I was recently at a conference a month or so ago, and we were talking about recruitment. So recruitment efforts and how do we get this younger generation into healthcare, into this really exciting field that has new technology and things like that. And we're always evolving and always learning. But how do we get the new younger folks, or even folks that are looking for a career change, into that field? And so I was talking with one of the panelists after the discussion. And so we were talking, and he posed a very pointed question, and he looked directly at me and said, "Why are you here? Why are you in healthcare?" And so that got me really thinking about, what is my why? Like, how can I inspire the next generation? And so, I have a really long path to get to where I'm at. And I often joke that I'm actually a professional student is what I am. I am continually learning. And so if you're looking for a field that you can evolve and, change your career path almost, but still be within healthcare. So at the root of my why is that I want to be able to have a personal connection with every person that walks through the door, or help my community, or help a person. If I go home and I know at the end of the day, when I go home and go to bed, I can sleep well knowing that I have made a difference in someone's life today. And being in healthcare is one of those fields that you can do that with, that you can sleep well at night knowing that you have helped someone somewhere. And so that is really the root of my why. But that being said, I took a really long path to get to where I'm at, like I mentioned. So I started an undergrad. I have a biology degree, and I really thought that I wanted to go to medical school. So my mom was a medical assistant when we were growing up. So I knew there was a couple of fields. You could work in a hospital, you could work at a doctor's office, but I knew there was kind of two things. Like, I knew physician or nurse. Those are the two things you usually think of with healthcare, right? But there's so much more. There's a huge world within healthcare. And so my path started that way with biology and integrative therapeutic practices. And then I actually went to medical school for 2 years because I'm like, I am dedicated to this path. Like, I am going to be a doctor. And then through that experience, I was like, maybe that's not quite the right path for me. I know that I still want to be helping people in some fashion. I know that I want to be in the hospital, but how can I really make this work? I've always been in love with the sciences. So then I found infection prevention. So I ended up getting a master's degree in health sciences. And then I have a graduate certificate in infection control, and then became board certified in infection control. So you guys, if you've heard me on the radio before, it's probably in that capacity. I was talking to you guys during COVID, talking about hand hygiene and how we can stop the spread of COVID and that sort of thing. So that was a very demanding time for sure. And so then my role has just continued to evolve. Like I said, I'm a professional student. And so my role has just continued to evolve. So I took on risk management, I took on quality and case management, and now I've made it to the position where I'm at now with associate administrator. And now I get to dive into the business side of the world, and that is fabulous as well. So like I said, healthcare is one of those industries that if you are a continual learner, you want to help people, this is where you can do that at. And so having that big impact on my community, rural health has really been speaking to me over the last 5 years. I know that this is my place. I love Fremont County. I love Riverton. I love Lander. I live in Riverton. Just shameless plug for Riverton. But I really love this community because we are treating our neighbors. We are treating those people that live next door to us. We're going to see them at Smith's. We're going to see them at Walmart. So these are people that we are continually talking to, that we see, that it really just rings true to my heart that I am helping my neighbor when I know that I'm working in this healthcare industry, which might be a little bit different from one of your larger metropolitan areas. So rural health just speaks to me in that nature. So that's a really long story of why I'm in healthcare, but I do. I love waking up in the morning. I love going to my job. So if any of those things are speaking to any of your listeners out there, please come and see us over at the hospital. We will figure out some way to make something happen for you. Let's figure out how we can get you into this industry and really just keep building your career. So.
Yeah, that's quite
great.
the answer. And, it's always interesting to hear people's backgrounds and kind of the path that they took to get where they are and sort of the insight and, advice that they can give to some of us who are maybe trying to find a path for ourselves too. Mm-hmm. So Kenny, tell us about your journey. What's your background and how did you get to your place here today?
So I always say that I grew up in healthcare. As a young lad, my mother was serving in the U.S. Army, and she was hospitalized, and we used to go to the VA hospital to visit her and to hear the stories of how the systems are bifurcated as no one communicates. The physician doesn't communicate with the nurses, and I always had a lot of questions. But I still didn't know my path was healthcare during that time. So later on, a lot of my family works in healthcare, through billing, continuing education, healthcare administration, finance, but I just say, hey, healthcare is not for me. Ideally, when I went to college, I was looking to work at like Goldman Sachs. My undergrad is in finance. So most of my conversation and my peers always talk about the top 4, top 5 financial companies, how we're gonna work long hours, we're gonna work the stock market, we're talking about derivatives and how we could short stocks. And that was interesting. We're looking at the Bloomberg machine. But I still was, at the time I was working at a hospital, but I enjoyed it. Mm-hmm. The enjoyment for me was you make a difference. Mm-hmm. Patients don't come, or people don't come to the facility to say, I want a bad experience. So it's like, how do you create this experience for our community, our patients? So my first job in the healthcare sector was in the emergency department. I didn't know healthcare. I just needed a job. I was good looking, had long hair, and I sat at the front desk and I smiled. But I didn't realize how impactful that was. People coming in the ER, they sick, and just a smile, you're engaging, you're creating this experience. I spelled everything incorrectly. I spelled diverticulitis. I didn't know what the difference was. When a patient come in, they say this, I need to put this. I was putting incorrect last names. And at the time they said, don't worry about it, they'll fix it in the background. But what was important to me was I created experience for the patients. And as I had worked in a hospital, it's North Beth Israel Medical Center. I'm from New Jersey, and that's my hometown medical facility. I was glamorized as I saw a gentleman that he was, at the time he was the vice president of operations, and I really didn't know what vice president of operations did, but he cared about the simplest things. He said, well, when the last time environmental service cleaned the bathroom? And I'm saying, you're the vice president, you got a nice Brooks Brothers suit on, you worrying about the bathroom. But then as I started to mature and understand is that people have to use the bathroom, and it's a reflection of us. And I continued to say, I want to do healthcare. And of course, you could look online to find out what the salaries look like, see if it's something to look forward to. And then I continued my journey in school. I had my undergrad in finance. Then I was looking for a master's degree, and I didn't want to do like an MBA because I felt that I have enough knowledge for far as what that curriculum offers. So I did public administration. And it was challenging because those classmates were smart. You had people with lawyers, judges, therapists. They had 15 years of executive program, and they spoke a language that was confusing to me. But I was intrigued, and I continued to learn and grow. But I transferred that knowledge I received to healthcare. How do I better serve my community, my patients? And I continue to support my knowledge in healthcare as I'm a board fellow of American College Healthcare Executive. I have other certifications to show my commitment to healthcare. So I've been out to Wyoming for a year. So someone asked me, said, what made you come to Wyoming? My simple response is, they said they needed help and I'm here. Because this is what I'm committed about. It's about healthcare and ensure that we make healthcare accessible to everyone. I am the director of patient financial services, but my first and foremost is about our patients. Do we create experience for our patients? Do they believe in us? Do we offer the right service at the right time for our patients? Everything else, it's on the back end. That's what my focus on. So every day at 3:30, I start my day because I'm looking at reports, I'm reading, figuring out what we can do better. How can I better understand my staff, engage the staff, provide them the tools to be supportive to the patients and our leadership. And that keeps me going. Then I start my day going to the gym. I go to Ironwork. So if you notice, I'm kind of a little pumped for my gym workout. I go to Ironwork.
We're on the radio, Kenny, so you're nice. He's a little buff.
Thank you.
Yeah.
But I have made Fremont County and Riverton and Lander my home. I often joke, but they think I'm joking. I'm serious that I'm be on the billboard saying, "Welcome to my town," because I'm committed. People go and hide from patients. I go looking. I go to Walmart every day. I look for everyone and see what we can do differently, what we can do better. I answer questions, how we can partner, what they need, and how we can provide it. I look forward to hiring people in our community. Since I've been here, I hired maybe, when I say I use the pronoun singular, but it's really a team effort. I won't say it's just me solely, but we hire people that's committed to our patients. So now it's to provide a skill set for the new hires that they can better serve our community and our patients. And also they can communicate to their community, to their neighbors, and say, hey, they offer a job, I have some skills, I'm here to help. So it's creating that vision. So just in closing, I would say that as we mature in our field, we stop telling our story. So I think we don't tell our story enough to people to encourage them to come into healthcare. So when we think of healthcare, we think of doctors and nurses. But we need to talk about our why, talk about our environmental service, some of the great things they do. Because if environmental service don't clean, we're not doing no surgery. Let's be honest. Nothing is happening.
Yeah.
No one's coming to work, no procedures being performed. So their job is important. So every role, every experience plays a part into what we do. So I'm appreciative of healthcare, and I always want to give back through teaching, through engaging, through inspiring, and sharing my story.
Well, that's wonderful to hear. I don't always tell this story, but I spent about a decade in healthcare myself. And I remember I was pretty young at the time. I was in high school and then through college. And I remember that sense when every night when you get home of making a real difference in people's lives. And I remember, being young and my friends saying, oh, well, let's just all call in sick to work. And they were working retail or whatever, and they didn't care if they weren't there. And I said, well, I can't do that. The people need me at my job, And it's hard to explain unless you've felt it before. But making a real difference in people's lives is such a rewarding feeling. And being able to carry that with you as a career is so invaluable. It is different than any other, job field out there, I think. And it's such incredibly important work, not to mention that there are just so many different jobs out there. And I know there's a stability in this field where you can kind of go anywhere in healthcare and find a job. And so I'm wondering, Jennifer, if you can maybe speak to, if we're creating that little spark in someone's mind right now. What advice do you have for them if they're thinking, you know what, maybe this sounds right for me? How do I take that first step? What's a good idea here in Riverton to kind of take a look behind the curtain and see what's going on and try to make your match when it comes to healthcare?
Sure. So start reaching out to the people that you know. Start asking some questions. Ask others who are already in that field. If you see me walking around the hospital, pull me aside. I'm more than happy to talk to you for a little while. But if it's something that you're interested in, start talking to the people that you know, start making those connections and saying, hey, what do you like about your job? Or, as a high schooler, or we have phlebotomy students that are going to start coming in from CWC, start there. Or if you just want to give it a try and dip your toe in the water, we've got those positions like our dietary staff. Our dietary staff is going into the patient rooms every single day. So you're going to get that patient interaction. Maybe you want to try out nursing, maybe, being a nursing assistant, something like that. We would like to build a program of shadowing and things like that in the future. I think that's something that we're probably looking forward to, especially if we want to build that spark. Something that the hospital has done is teaming up with the high school and doing those STEM, like the women in STEM, men in STEM. I've been a part of that for a couple of years and have really enjoyed doing that sort of thing. So if there are those sorts of activities, try to join in there. I think those are probably the biggest thing that I would say. Ask about shadowing opportunities and see if there's people that you know that you can start asking those questions to. And then, I think those are probably the big things. Just get in there. Yeah,
Yeah.
ask the questions. There's no stupid questions.
Yeah.
So just ask somebody. Yeah.
I think it's so cool too because there are a lot of entry level jobs at SageWest that people can kind of get their foot in the door and see the different roles that are out there.
Definitely.
And we are so fortunate here, I think, in Fremont County with CWC has such an incredible nursing program. They've got phlebotomy, nursing assistant. There's all kinds of different certificates and licensing that you can get right here locally. Too. And so there are all kinds of opportunities. I know there are a lot of even high school age students who, are already taking college credits in high school, and they're able to kind of get in the door there and start taking those baby steps up the ladder in healthcare. And that's one thing that I find really interesting too, is that a lot of people working in healthcare kind of work their way up in different positions. So maybe you start off as a nursing assistant, or you start off in environmental health, or some other role in the hospital, and you're in the background. You're kind of going to school, and you're getting that next certificate up, and kind of seeing what path you want to take, because there are so many.
Yes.
Yeah, so that is just a little kind of twinkle in the eye maybe for some folks. And maybe you're a mom or dad out there thinking, I'm little Junior is sort of, doesn't have a super solid path or idea of what he or she's going to do, but here is an idea to explore. So we can do that locally for you. If you check out SageWest, they've got all kinds of open positions for folks out there who are interested in sort of getting their foot in the door and finding such a rewarding and valuable career.
Absolutely.
Now, one thing that we've talked about a few times this month, but I think we can't talk about it enough, it is Breast Cancer Awareness Month, and SageWest has basically made it so easy to get in there and get your mammograms this month. They've kind of moved all of those hurdles, the excuses that we make when we procrastinate mammograms, here to celebrate that month. And I'm wondering if you guys can kind of explain what the Walk-In Wednesday program is about here for October to get us in there to get those mammograms checked off our list.
I'll just say we've removed every barrier. Just come on in and see us.
Absolutely. It's really partnering with our community, allowing them to say, hey, instead of scheduling an appointment, we're available, because we want to ensure that we make healthcare accessible to our community and to our patients. So on Wednesday, they could just come in, sign up, and get their test done. And I will encourage men too, because we don't talk about it enough, but there are studies and people have seen men does have breast cancer and different issues. So we need to talk more about it on the male point of view as, hey, put yourself in, come. If you're not comfortable, I'm there. I'll walk you through from start to finish, and we can work together.
Yeah, that's great. So through the month of October, from 7 a.m. to 6 p.m. on Wednesdays, you can walk into SageWest Riverton campus and get your 3D mammogram. Now, we also know that SageWest has got the accreditation, the certification, the best mammogram services that you can get in the United States. So you can be assured that you're getting very carefully checked over. You can have confidence in those mammograms, and check that off your list. I think for a lot of us, that ends up being on the to-do list, and we sort of drag our feet and say, oh, I'll take care of that next time. But you don't need an appointment on Wednesdays in October. You can get that service done. And I think that we've talked about, even people who say, well, gosh, I don't even have a primary care provider, or, I have some other questions, or I'm not certain about my insurance or whatever. SageWest has really kind of ironed out those things for you. So you can still walk in, you can still get this done, and they're going to take care of you every step of the way.
Definitely.
They have great staff that's conducting the test. Oftentimes, as colleagues, we hear what we do, but to actually look at it, I have shadowed some of the techs that's performing different test procedures, and they are fantastic. Patient-centered, meticulous in the explanation, what they're going to do, what to expect along the continuum. It's a fantastic team. here. So I encourage everyone. It's like you're in great hands. It's almost like the Allstate commercial. You're in great hands with Allstate. You're in great hands with the technicians at SageWest.
Yeah. It's really great to hear that you've got this available for people. And I think, if whether I'm speaking directly to you and you're kind of in that group where, hey, we've checked the 40th birthday off the list and now it's really time we're supposed to be doing this. Or maybe it's someone you love. Maybe it's your mom. Maybe it's your wife. Maybe it's your daughter. Let's make sure that we're encouraging folks to get out and take advantage of Walk-In Wednesdays with SageWest here at the Riverton campus. Every Wednesday from 7 a.m. to 6 p.m., you can walk right in, get your mammogram taken care of, and it couldn't be easier, honestly. Now, Jennifer, it sounds like you guys are really making some progress here this year in getting more folks through the door to take advantage of this. So can you tell us a little bit about how it's going so far in October?
Yeah, we are doing great so far. I think I heard yesterday that we are 10 exams off from what we did last year. And so I think we can definitely help our community and get as many people in the door and maybe even surpass what our number was for last year. So I think this has been a success so far.
Absolutely.
I'm really excited to hear what the final numbers are. It's a big deal at the hospital. We talk about, the Walk-In Wednesdays and how well it's going. And so any positive feedback, any feedback, but I'll take the positive feedback. But all the feedback that we receive has been positive so far. And so that's great. And once again, just serving our community, helping people, that's what we're here for. So,
Absolutely.
yeah.
It is Wednesday today, folks. So
It is Wednesday.
yeah, we've got time today to fit you in. SageWest is ready and got that door wide open for you,
Come
folks.
on over.
Yeah. So I wanted to thank you guys so much for joining me today. And I'm wondering, Kenny, if you can give us a little kind of closing message. If you've got advice to somebody out there who's thinking, I'm not quite sure what the path ahead of me is, but I heard this guy on the radio talking about healthcare and I got a little curious. What advice do you have for that guy?
I would say that ask questions. A lot of us stop dreaming, get off AI, dream, ask questions. People will tell you what steps you should take. You'll be vulnerable, but it's okay. So if you're unsure and say, I want to go in healthcare, I'm not sure, come to the hospital, speak to people, and that's how we learn. So I would encourage anyone that's thinking about healthcare, they're not sure, come by, ask questions, ask a lot of questions. Then go back home, think about it, and come back and ask more questions. And we can work together as to align what some of the ways that work for me, some of the things that I have learned over time, or what you have learned over time, and what, some consideration as how they can progress in their career path.
Absolutely. Well, wonderful advice for folks out there listening. And one more time here, we've got today and then we've got next Wednesday to take advantage of Walk-In Wednesdays. The door is always open at SageWest, but Wednesdays this month, it's just so much easier to get that mammogram in as we celebrate Breast Cancer Awareness Month. Thank you so much, Jennifer and Kenny, for joining me today. It's been such a pleasure.
Thank you.
Likewise.